Welcome to Gamble with Brandl. Today we have a 38-year-old man who was recently diagnosed with major depression, and he started on sertraline. And the patient is at greatest risk for which of the following? And we're given here a couple of adverse effect choices. Let's think about it. So sertraline is what? Sertraline is a SSRI, a selective serotonin reuptake inhibitor, which is used fairly commonly as an antidepressant. So what are adverse effects of SSRIs? What do SSRIs do? Well, they increase serotonin because they don't let the serotonin back into the nerve terminal, so you're going to have more available, and that helps for depression. Adverse effects are always what I consider as 3 S's, so that you can remember them: stomach upset. And remember, there's a lot of serotonin in your gastrointestinal tract, actually way more than in your central nervous system. Then sexual dysfunction. The moment you stimulate a certain serotonergic receptor, it's 5-HT2A, you can get sexual dysfunction, anything from a delayed ejaculation or anorgasmia. And then this third S stands for serotonin syndrome. And serotonin syndrome is characterized by autonomic instability, so you have autonomic hyperactivity, blood pressure goes up, you're sweating. Then there's also hyperreflexia, so too much muscle reflexes, and there's also changes in mental status, so confusion, patient is not oriented, so that's serotonin syndrome. You have too much serotonin around. Usually that happens when you're combining several medications that all lead to an increase in serotonin or stimulate serotonergic receptors. So these are the 3 S's, and we should also not forget, for serotonergic drugs like SSRIs, an increased risk of bleeding, because serotonin has actually inhibitory effects on platelets. So if you have too much serotonin around, well, then you're of increased risk of bleeding. So these are a couple of adverse effects that are very important, the 3 S's, and then an increased risk of bleeding. If you are thinking about greatest risk, which is here now also a key term, well, stomach upset is very, very common. Sexual dysfunction is very common. Serotonin syndrome is rare. It's very dangerous, but rare. And mainly in combinations, it's not so likely just with one drug. So if you're going over here and thinking about the different choices that we have, hypertensive crisis, not typically seen with an SSRIs. That would be something that you could see with an MAO inhibitor if you combine it with wine and cheese, with a very famous drug-food interaction. We have too much tyramine then, because tyramine is metabolized by MAO, and then you're going to have too much of this indirect sympathomimetic. So this would be something where we would rather think about an MAO inhibitor. Delayed ejaculation, that's sexual dysfunction. So that's the correct answer here. That's very common for an SSRI. Serotonin syndrome is correct, could happen for an SSRI, but definitively not the greatest risk, because that's rather rare. Urinary retention, that's a muscarinic antagonistic effect. That's something you could, for example, see with TCAs or with other drug. Postural hypertension, that's something you see with alpha-1 blockers, where the TCAs have also some alpha-1 antagonistic capacity. So the correct answer here is sexual dysfunction, delayed ejaculation, which is very common for SSRIs such as sertraline.